Hello, everyone. Good afternoon. Interested in mental health, to have open discussions about mental health. And we're supported by the University of Leicester, which is why we're using their Zoom platform to have this event today.
Thanks, Johanna. So hi, welcome everybody, and thank you so much for joining us today. To all the people who've joined to listen to what's being said, but also to colleagues from the NHS for giving up your Saturday afternoon to come and listen to us. We probably won't be joined by a huge amount of people, but I know a lot of people want us to share this with them, so it will be recorded. So whilst they may be a bit camera shy, they do want to listen to what's being said and listen to the questions and the answers to the questions. So Rahana, I don't know if we're expecting a couple of more people to join.
We were supposed to, but they may join in later. Let's see what happens. You never know with these things.
Yeah. So if we give it a minute or two, we'll do some introductions and then we can make a start, if that's okay.
Lovely. I have got some questions from people and comments that people have made, so perhaps we could share those later on as well and see if some of those questions can be answered.
That'd be brilliant. Thank you. I don't feel so bad because the sun's not shining. Okay. I mean,
Jasmine, can I quickly grab a tea, please? Thank you.
Make the start. I don't want to keep what. Yeah, do. I just realised not yet 3. Let's just wait a few minutes.
Yasmin, I'm going to make you co-host, so it makes it easier. There you go. Done.
That could be a dangerous thing.
I'm sure it won't be. Known you long enough for that. Shirin's going to join us as well. There we go. Yeah.
Hi.
I think Jamila was supposed to join us as well, so I'm not sure.
She is. She called me. She's joining at 3, I think.
Okay. Oh, there's somebody to admit. Very lovely. That person gone who's joining. We lost them.
Okay, we'll just give it a minute and we'll start at 3. And if people want to join as they do, then that's great. Afternoon, Rasham.
Hello. Hello, Yasmin. I just sent you the message that I'd like to organize something for the Sikh and other communities, this Zoom meeting in 3rd week of March. And just to, you remember that thing which we are doing with Tom Wilson, just to organize that meeting. And I don't know who to invite from the medical specialist. So if you can give me 1 or 2 names. And I'm asking same thing to Jafar as well.
Yeah, I'm happy to do that, Rishab, for you, no problem.
All right. Okay, that's fine. Very good. Yes.
I've got people on the screen here today.
I can
Yes.
support if you like, yeah.
All right, okay.
You've got Rebel will be able to help to organise that. Brilliant. Okay, shall we make us? So if we just do some introduction, so I'll start if people don't mind. So I'm Yasmin Surti, and I work within the area of learning disabilities and have worked in mental health and learning disabilities in my professional role, but involved in a lot of voluntary work, particularly with the Federation of Muslim Organisations. Rahana and I set up a charity for people with learning disabilities many years ago. So it's an area of real interest for me, and with the cohorts 5 and 6 now being vaccinated, we felt it was really important to have this conversation, but also in terms of the wider Black and ethnic minority communities, you know, because people will listen to this, we will put it out, and I know the CCG want to as well, give people the benefit of listening to some of the questions and some of what's being said today, with the hope that it may encourage more to be a bit more confident about taking up the vaccine. So I'll just go around as I see people on the screen. So if I start with Rahana and Shirin.
Right. I just reintroduce myself to those who weren't there when I said I set up Jamila's Legacy about 5 years ago now, and it's completely voluntary. We do it for it's open to anybody, and literally it's about bringing people together to increase awareness and deepen understanding of mental health. And you know, we've had lots of wonderful conversations with people, and they felt safe to talk about mental health and the challenges they face. Unfortunately, with the pandemic, we have not been able to meet, so it is Zoom that we're using, and that works for some people, but not for everybody, just the same as people with learning difficulties and learning disabilities. You know, you have to find other ways. So if it's telephone support, you know, text, WhatsApp, whatever works for people. And that's what I do in my spare time. And in my professional role, I teach children and adults. That's basically what I do.
Hi everyone, I'm Shireen. I'm also part of Jamila's Legacy, and when we were meeting before, we were doing a lot of training on different areas of mental health and just supporting with that, and I'm a counsellor psychotherapist in my professional role.
Thank you. I'm going to come over to, is it Sulu? You're on mute, sorry.
I think that, I don't know why it shows that name. So my name is Dr. Sulakshmi Nenani. I'm one of the GPs in Leicester City, and I'm also on the City CCG board. So yeah, it's lovely to meet you all, and really happy to support you in any way I can.
Thank you, appreciate it. Abdish?
Hello, good afternoon, everyone. It's Assalamu alaikum. Good afternoon. My name is Abdishakur Tara. I am Senior Project Manager for a charity called Lacoon School Home Support Services, which is based in Leicester. And we do provide some advocacy, academic coaching and mentoring to children and young people in schools. We also work with families with disabled children and carers. We also have different projects, mainly around education, schooling, disability and special needs. And it's great to see you, and some of you have already know you, so great to meet again. Thank you.
I should have said I'm chair of that organisation as well.
There you go. Yasmin is our chair. Thank you, Yasmin.
Rachna.
Good afternoon, everyone. My name is Rachna Vyas. I'm the Exec Director for Integration and Transformation. I work for the local NHS, helping to roll out the vaccination programme. As Dr. Nenani said, really excited to be here. Lovely to support the community. And Yasmin, I know we've spoken several times, but we're happy to support in any of these kinds of events going forward for our various communities across Leicester, Leicestershire, Rutland. So please do get in touch after this if there's anything else that we can support with.
Indeed, I really appreciate it, as I said. Thank you. Resham Bhai?
Yeah, Resham Singh Sandhu. I'm chair of Sikh Welfare and Culture Society and Leicestershire Faith Forum, as well as there are so many other hats I wear, which may going to take a little while, but I just leave it there.
Thank you.
Thank you.
Zafar?
Assalamu alaikum, everybody. My name's Zafar Haq. I'm a local businessman, but I got involved in health campaigning in 2000, about 20 years ago. And for the last 5 years, I've been on the board of the Leicester City CCG as an independent lay member, so actively involved in trying to improve the lives of patients across the city and county as well now.
Thank you. And greatly appreciated, I know, by the community as well as the health service. Dave.
Hi, I'm Dave Rowson from the CCG's Head of Communications. Really keen to see what comes out this afternoon, because working with people, my colleagues Rachna, we sort of use this to really shape the sort of communications and engagement work going forward. So it's really important to hear. And just in terms of what Risham said, he can contact Tom, or anyone can contact Tom Wilson if that's easier. And Tom gives me a list sort of pretty much every day or each week of people that are looking for support. So we're coordinated. So more than happy, as you know, Rachna has said and Zufra has said, to help you in terms of people that you need.
Thank you. Thank you. Asma.
Assalamu alaikum and hello. My main role is I'm a full-time carer for my 23-year-old Aisha Sidat. She's on here, but her camera's not working, so she's unable to switch that on. But yeah, I'm happy to help in any way, give any support. Myself and my younger daughter, who's full-time support carer for Aisha, we have been vaccinated. We're just, Aisha's got an infection going on at the moment, so that's the only reason why she's not had her vaccination. But yeah, otherwise, yeah, happy to support in any way.
Thank you. And really important in terms of supporting other carers to kind of get that confidence as well to enable their people to be vaccinated. So thanks for joining us. Fabida?
Hi everyone, I'm Dr. Fabida Arya. I'm a consultant psychiatrist, associate medical director at Leicestershire Partnership Trust. I'm happy to help in any way I can with regards to mental health services and learning disability services. I also am part of the Royal College of Psychiatrists Transcultural Psychiatry Group. And last year we had done a lot of videos in different languages about what precautions to take for COVID. So if any of you all want help from that group, I'm more than happy to ask as well.
That's really good to hear. Thank you. Shamima?
Hi, my name is Jamila. I'm from Leicester City Council.
Thanks, Shami. Aisha? Your mic's not working as well. Okay, but we know that you're there. Aisha, if you want to type anything in or
I think
get
she's
your
got
mum
a
to...
message for you. Yeah, I think she's written a message. You
Yeah.
see the message, yeah.
Rahana, you're more technical at this than I am, so you read the messages.
Yeah, I can do that.
Thank you.
I'm just trying to find Aisha's because it popped up and now it's gone away again.
I know I saw something saying her mic is not working and her camera.
Yeah, sorry, my mic and cam isn't working. I'm Aisha and I have a disability, which means I fall into the clinically extremely vulnerable. I have interest in disability and mental health and have been able to help these groups during the pandemic. Is there a little bit more?
Thank you. Thanks, Aisha. Is there anybody that I've missed? Okay. Okay, so Rahana, if you want to just start with some of the, because I know you've been talking to people who couldn't join today, but wanted to
I think some people are feeling quite overwhelmed and bombarded with information because they're getting information from everywhere. And I remember having a conversation with somebody, and they said to me, "Oh, well, I'm all COVIDed out." And I said, "What do you mean by that?" She says, "Oh, well, I've got all the information I need. I get it from everywhere. Everybody's telling me I know everything." Yet it wasn't the case. But this is why events like this, discussions like these are really important. Even if people are not attending, just people hearing things, it can, put people right. And sometimes, oh, this is what I thought, but oh, actually it's this. So there's lots of distrust with things like the government and conspiracy theories, especially from places like India, that people are getting their information from on WhatsApp groups and all sorts of things like that. And they make these videos that look really realistic, and people that look like they're professionals talking about what they know, and this is what's frightening people. And sometimes there's distrust because they're thinking, well, these people are from our community, they're talking our languages, they're from our culture, it must be true, so I think that can be a problem for a lot of people. And I think not just only the vaccine, the whole pandemic, as we know, there are, and I'm not just saying this is happening in Black and minority ethnic communities, but I know it's maybe more where people don't believe in it. People think this is all the government trying to control, So I think these are real things that we, whether, we hear it or not, people believe these things. It makes them extremely vulnerable. And obviously we're talking about already vulnerable groups, and who, if they're misinformed, will be reluctant to take the vaccine and are reluctant to take the vaccine.
That's really helpful. And you're probably aware of some of the kind of social media that's going around, that talks about Black conspiracy around. I think one of the key things is around how quickly the vaccine was developed.
Yes.
And therefore it's not been tested enough. And so nobody knows what the effect will be. And also, why is there so much messaging around people from Black and ethnic minority communities? So again, is this something to harm that particular community? So it'd be helpful just to kind of address those things, I think, to start with. I don't know who wants to come in on that.
Do you want me to come in on that?
Yeah, please.
Yeah. So I think what we need to focus on, I mean, we obviously cannot stop the negative videos from going around, but what we want to focus is on the positive messages around this vaccine, and that is very key. So our messages need to overtake the negative messaging. So while people might feel that the vaccine was developed quickly, what we need to understand, it's like, going from here to, for example, to London. If all your roads are cleared off, you're going to reach very quickly. So all the barriers, all the administrative barriers and all the other things which normally take time, in any of the things, there's a lot of administrative burden. So if you fast track that process, but not actually the clinical part. So a lot of people were taken into the studies. The whole study was done properly, absolutely appropriately, but it's the administrative thing which was fast tracked, not the other things. So, that's why it was done. And the priority of the whole world at that point was to just focus on the vaccine. When you're trying to do other things, then your priority doesn't go on one thing. But here we actually prioritize just the vaccine, and that's why it was done. But it doesn't mean that the clinical part wasn't taken or the scientific thing wasn't done while we were developing the vaccines.
And I think that's a really, really important point, because, we lay people don't have the knowledge, the scientific knowledge, or how a study is conducted. And so, very quickly people can put doubt in people's minds and make them think, oh, well, maybe we're just guinea pigs. It's not worked. We don't know how effective it is, and they've rushed it. They're just doing this to just say, look, we've got an answer, we've got a solution. So I think it's really important. It's really good that you've explained that, that it wasn't rushed and it was done properly. It was all these studies are being conducted properly. There's a lot involved. There are rules, there are ethics,
Absolutely. It went through the whole ethical committee. It went properly through the MHRA. It got approved nationally and everywhere across the country, world, before it was actually given to before we got the vaccines. And if you think about it, all the health and social care workers, everybody's had the vaccines. Clearly, if none of these people believed in the vaccine, they wouldn't have had it. So and that's why I just want to reassure everybody that it wasn't a fast track process. It was just all the other barriers which normally come were taken aside, but actually the vaccine itself had a full scientific committee looking into it before actually approving it.
Have we got, sorry, Yasmin, I was just going to say, have we got anybody that speaks one of the Asian languages that could actually explain what you've just said, Doctor? because that would be really good.
Rachna? Sorry, I don't speak Gujarati, sorry.
Which languages are we talking about? And we can appropriately make sure we've got the right translation, Rahana.
Yeah, even if it's just basic, any of the South Asian languages, but also for Abdi Shakrutara's group, anybody as well, that would be good. But I mean, I don't know whether Abdi, you could do it yourself, but it would be really good.
I'm sure he could. So I think, Rachna, maybe a bit of Gujarati, a bit of Urdu, and Abdish, if you could just explain that in Somali.
Actually, the reason why, as you can see, I'm in the office. The reason why I came here is to translate one letter from the NHS, one also create a video on Somali language about vaccination. And I've already done most of the translation into Somali, and also doing the video into Somali and sharing that platform with possibly the Mayor of London, Sadiq Khan. So I will soon be becoming a celebrity as well, just to let you know. So, but in terms of the other languages, I think I'm happy to get in touch with the Leicester Complementary Schools, because we have over 80 schools in the city. I'm calling, supplementary schools, where they teach languages, and I think they are brilliant, language specialists on every community languages, who are actually teachers, but they know the language very well. So we can tap that resources as a way of actually using the transfer.
For today.
Hello.
If you could just
you're cutting.
explain what the doctor
Your voice is breaking up, Yasmin.
Okay, can you hear me? Raj, do you want to? Okay, let's start with Rachna in Gujarati.
Right, so disclaimer right now, if this gets to my mum and she'll be hanging her head in shame, so I'm gonna do my best. Okay, so જે question પૂછ્યું હતું કે આ વેક્સિન જે બનાવ્યું છે એ સેફ નથી અને બધા જે પ્રોસિજર્સ આપણે જે નોર્મલી ફોલો કરીએ એ નથી થયા. That's the main concern. Actually આપણે જોઈએ તો જે પ્રોસિજર્સ બધા ફોલો કરવાના હતા એ એક પ્રોસિજર ફોલો કર્યું હતું. પ્રોબ્લેમ શું છે કે જે વધારે જલ્દી કરવા જાય આપણે તો શું થાય છે કે જે એડમિન ને રેડ ટેપ ને એવું બધું વચ્ચે વચ્ચે આવે એ બધું એ લોકોએ કાઢી નાખ્યું અને બધું કાઢી નાખ્યું એટલે જલ્દી બધું અપ્રૂવ થઈ ગયું. પણ અત્યારે જે સાયન્સનું કમ્યુનિટી છે એ લોકોએ એક ટેસ્ટ જે કરવાના હોય એ કર્યું છે. અત્યારે તમે જુઓ તો બધા જે હેલ્થમાં કામ કરે છે કે કેર સર્વિસીસમાં કામ કરે છે બધાએ વેક્સિન લીધું છે. એ વેક્સિન એ લોકો ટ્રસ્ટ ના કરતા હોય તો એ લોકોએ ના લીધું હોત. એટલે પહેલી વાત તો એ છે. બીજી વાત આપણે જે વિચારીએ કે અત્યારે આખી દુનિયામાં આટલા બધા સાયન્ટિસ્ટ છે, બધા ડોક્ટર છે, એક કન્ટ્રીમાં બધાએ અપ્રૂવ કરી છે. એ એક કન્ટ્રીએ અપ્રૂવ ના કરી હોત તો આખી દુનિયા આ વેક્સિન ના વાપરતી હોત. એટલે એ બે વસ્તુ આપણને આપણા માઇન્ડમાં રાખવાની. અત્યારે જે બધું ઇન્ફોર્મેશન આવે છે બધાને વોટ્સએપ ઉપર, તમે વિચારો અત્યારે મારા મમ્મીના ફોન ઉપર હું જોઉં છું દરરોજ કે કંઈક ના કંઈક મેસેજ આવતા હોય કે આ સેફ નથી, કે એમાં મીટના પ્રોડક્ટ્સ છે, કે એવા બધા જે આપણને ડરાવે. એકચ્યુઅલી એકેય વસ્તુ રાઈટ નથી અને ખબર નહીં કેમ બધા એકચ્યુઅલી કરે છે આવા મેસેજીસ, બિકોઝ આ સેફ છે. આપણે સાયન્ટિસ્ટ બધા કહે છે કે સેફ છે, આપણા ડોક્ટર બધા કહે છે કે સેફ છે, અને આપણા પોતાના કમ્યુનિટી માટે, આપણા પોતાના હેલ્થ માટે અને આપણા છોકરા અને નેક્સ્ટ જનરેશન માટે ઇટ્સ વેરી ઇમ્પોર્ટન્ટ કે આપણા કમ્યુનિટી આ વેક્સિનેશન લે અને ખુશીથી લે કે એકચ્યુઅલી this is the right thing to do. સરખી વસ્તુ છે અને ખરાબ વસ્તુ નથી. So Yasmin, please do not let my mum hear that. She will absolutely go nuts if she hears the quality of my Gujarati.
All those Gujarati lessons. Thank you, Rachna. It's really helpful. And Zafar, I don't know if you could just translate that into Urdu or
Punjabi. Sorry.
Punjabi.
Yeah, I can do a bit of. Well, actually, Resham can do Punjabi. He's better than me at Punjabi. Yeah. So if you want to do that first, I think that's probably better.
Resham bhai?
No. My Punjabi is Pendu Punjabi.
It will do for us.
Yeah, I think ਇਹੋ ਹੈਗਾ ਕਿ ਪੰਜਾਬੀ ਦੇ ਵਿੱਚ ਟ੍ਰਾਂਸਲੇਸ਼ਨ ਕਰਨਾ ਮੈਡੀਕਲ ਟਰਮਸ ਦਾ ਬੜਾ ਡਿਫਿਕਲਟ ਹੈ, ਪਰ ਸੇਮ ਟਾਈਮ ਜਿਹੜੀਆਂ ਲੋਕਾਂ ਤੋਂ ਅਫਵਾਹਾਂ ਆਉਂਦੀਆਂ ਹੈਗੀਆਂ ਉਲਟੀਆਂ ਸਿੱਧੀਆਂ ਔਨ ਦਾ ਸੋਸ਼ਲ ਮੀਡੀਆ, ਵੀ ਹੈਵ ਟੂ ਆਪਾਂ ਨੂੰ ਬਹੁਤ ਕੇਅਰਫੁਲ ਰਹਿਣਾ ਚਾਹੀਦਾ, ਕਿਉਂਕਿ ਉਹ ਸਾਰੇ ਆਪਣੇ ਆਪ ਨੂੰ ਕਲੇਮ ਕਰਦੇ ਕਿ ਅਸੀਂ ਪ੍ਰੋਫੈਸ਼ਨਲ ਆ, ਪਰ ਉਹ ਪ੍ਰੋਫੈਸ਼ਨਲ ਨਹੀਂ ਆ। ਸਾਨੂੰ ਜਿਹੜਾ ਯਕੀਨ ਆ ਉਹ ਆਪਣੇ ਡਾਕਟਰਾਂ ਤੇ ਆਪਣੇ ਸਪੈਸ਼ਲਿਸਟ ਜਿਹੜੇ ਹੈਗੇ ਆ ਆਪਣੀ ਗਵਰਨਮੈਂਟ ਤੇ ਸਾਨੂੰ ਟਰਸਟ ਕਰਨਾ ਚਾਹੀਦਾ। ਠੀਕ ਹੈ ਕਿ ਨੰਬਰ ਆਫ ਇਸ਼ੂਜ਼ ਰੇਜ਼ ਕਰਦੇ ਆ ਲੋਕ ਵੇਰੀਅਸ ਮੀਟਿੰਗ ਦੇ ਵਿੱਚ, ਵੇਰੀਅਸ ਜ਼ੂਮ ਮੀਟਿੰਗਸ ਐਂਡ ਆਲਸੋ ਵਿਦ ਦ ਕਾਉਂਸਲਰਸ ਐਂਡ ਪਬਲਿਕ ਹੈਲਥ, ਪਰ ਹਰ ਇੱਕ ਡਿਪਾਰਟਮੈਂਟ ਟਰਾਈ ਕਰਦਾ ਹੈਗਾ ਕਿ ਅਸੀਂ ਇਹ ਕਲੈਰੀਫਾਈ ਸਿਚੁਏਸ਼ਨ ਨੂੰ ਕਰੀਏ, ਪਰ ਕਦੀ ਇਹ ਲੋਕਾਂ ਦੇ ਦਿਮਾਗ ਵਿੱਚ ਬੈਠ ਜਾਂਦਾ, ਪਰ ਫਿਰ ਵੀ ਉਹ ਜਿਹੜੇ ਲੋਕ ਆ ਕੇ ਗੱਲਾਂ ਕਰਦੇ ਆ ਜਾਂ ਆਪਣੇ ਕਮਿਊਨਿਟੀ ਦੇ ਬੰਦਿਆਂ ਤੋਂ ਸੁਣਦੇ ਆ ਜਾਂ ਆਪਣੇ ਰਿਲੀਜੀਅਸ ਪਲੇਸਿਸ ਤੇ ਜਾ ਕੇ ਜਿਹੜੇ ਪ੍ਰੀਚਰ ਹੈਗੇ ਉਹਨਾਂ ਤੋਂ ਸੁਣਦੇ ਆ, ਤੇ ਦਿਨ ਦੇ ਉਹਨਾਂ ਦਾ ਆਪਣਾ ਮਾਈਂਡ ਉਹਨਾਂ ਦਾ ਚੇਂਜ ਹੋ ਜਾਂਦਾ। ਪਰ ਸਾਨੂੰ ਆਪਣੇ ਆਪ ਤੇ ਟਰਸਟ ਕਰਨਾ ਚਾਹੀਦਾ, ਤੇ ਸਾਨੂੰ ਆਪਣੇ ਜਿਹੜੇ ਜੀਪੀ ਆ ਉਹਨਾਂ ਤੇ ਟਰਸਟ ਕਰਨਾ ਚਾਹੀਦਾ। ਸਾਨੂੰ ਆਪਣੀ ਜਾਨ ਨਾਲੋਂ ਦੂਸਰੇ ਲੋਕਾਂ ਦੀ ਜਾਨ ਦਾ ਫਿਕਰ ਹੋਣਾ ਚਾਹੀਦਾ, ਕਿਉਂਕਿ ਜੇ ਅਸੀਂ ਇਹ ਵੈਕਸੀਨ ਨਾ ਲਵਾਵਾਂਗੇ ਤੇ ਦੂਸਰੇ ਲੋਕੀ ਜਿਹੜੇ ਆਪ ਸਾਡੇ ਦੋਸਤ ਆ ਜਾਂ ਫੈਮਿਲੀ ਮੈਂਬਰ ਆ ਜਾਂ ਰਿਸ਼ਤੇਦਾਰ ਆ ਜਾਂ ਸਾਡੀ ਕਮਿਊਨਿਟੀ ਦੇ ਵਿੱਚ ਹੈਗੇ ਆ, ਉਹਨਾਂ ਨੂੰ ਵੀ ਖਤਰਾ ਹੋ ਸਕਦਾ ਹੈਗਾ। ਇਸ ਕਰਕੇ ਸਾਨੂੰ ਇਹ ਜਿਹੜੀ ਵੈਕਸੀਨ ਆ ਇਹ ਲਵਾਉਣੀ ਚਾਹੀਦੀ ਆ। ਜੇ ਕੋਈ ਹੋਰ ਇਸ਼ੂ, ਕੋਈ ਬਹੁਤ ਇੰਪੋਰਟੈਂਟ ਇਸ਼ੂ ਹੈਗਾ, ਨੈਕਸਟ ਵੀਕ ਸਾਡੀ ਮੀਟਿੰਗ ਹੈਗੀ ਆ ਮਿਨਿਸਟਰ ਦੇ ਨਾਲ, ਰਾਊਂਡ ਟੇਬਲ ਮੀਟਿੰਗ ਵਿਦ ਦਾ ਮਿਨਿਸਟਰ, ਤੇ ਉੱਥੇ ਹੋਰ ਵੀ ਡਿਪਾਰਟਮੈਂਟ ਦੇ ਸਪੈਸ਼ਲਿਸਟ ਹੋਣੇ ਆ, ਤੇ ਉਹ ਤੁਸੀਂ ਮੇਰੇ ਨਾਲ ਰੇਜ਼ ਕਰ ਸਕਦੇ, ਮੈਂ ਉੱਥੇ ਰੇਜ਼ ਕਰ ਸਕਦਾ। ਇੱਕ ਬਹੁਤ ਕਨਫਿਊਜ਼ਿੰਗ ਪੁਆਇੰਟ ਆਇਆ ਹੈਗਾ, ਡਿਪਾਰਟਮੈਂਟ ਆਫ ਹੈਲਥ ਐਂਡ ਲੋਕਲ ਗਵਰਨਮੈਂਟ ਦੇ ਆਫਿਸਰਸ ਨੇ ਈਮੇਲਾਂ ਭੇਜੀਆਂ ਹੈਗੀਆਂ ਵੈਕਸੀਨ ਦੇ ਬਾਰੇ, ਤੇ ਜਿਹੜੇ ਪ੍ਰਾਈਮ ਮਿਨਿਸਟਰ ਨੇ ਦਿਸ ਰੋਡ ਮੈਪ 4 ਸਟੈਪਸ ਆਪਾਂ ਨੂੰ ਭੇਜੇ ਆ, ਉਹਦੇ ਵਿੱਚ 8th of March ਨੂੰ ਬੜੀ ਕਲੀਅਰਲੀ ਸਟੇਟ ਕੀਤਾ ਕਿ ਮੈਰਿਜਸ ਕੈਨ ਹੈਪਨ, ਕਿ ਓਨਲੀ 6 people ਕੈਨ ਅਟੈਂਡ ਦਾ ਮੈਰਿਜਸ। ਉਹ ਮੈਂ ਕਲੈਰੀਫਾਈ ਕਰਨ ਦੀ ਕੋਸ਼ਿਸ਼ ਕੀਤੀ, ਜਿਹੜੇ ਆਪਣੇ ਰਜਿਸਟਰੀ ਆਫਿਸ ਹੈ ਲੋਕਲ ਇਨ ਲੈਸਟਰ, ਉਹਨਾਂ ਨੇ ਉਸ ਰਿਬੈਕਾ, ਆਈ ਥਿੰਕ ਹਰ ਨੇਮ ਇਜ਼ ਸਮਥਿੰਗ, ਐਂਡ ਉਹਨੇ ਮੈਨੂੰ ਈਮੇਲ ਕੀਤੀ ਕਿ ਦਿਸ ਇਜ਼ ਇਨਕਰੈਕਟ ਇਨਫੋਰਮੇਸ਼ਨ, ਕਿ 29th ਨੂੰ ਮੈਰਿਜਸ ਜਿਹੜੀਆਂ ਹੈਗੀਆਂ ਉਹ 6 ਲੋਕਾਂ ਦੇ ਨਾਲ ਹੋ ਸਕਦੀਆਂ ਹੈਗੀਆਂ, ਉਹ ਤੋਂ ਪਹਿਲਾਂ ਨਹੀਂ। ਤੇ ਮੈਂ ਉਹ ਸਾਰੀ ਇਨਫੋਰਮੇਸ਼ਨ ਜਿਹੜੀ ਗੁਰਦੁਆਰਿਆਂ ਨੂੰ, ਅਬਦੁਲ ਕਰੀਮ ਘੀ ਵਾਲਾ, ਹੋਰ ਮਾਰੇ ਜਿੰਨੇ ਵੀ ਫਰੈਂਡ ਹੈਗੇ ਨੈਟਵਰਕ ਦੇ, ਉਹਨਾਂ ਨੂੰ ਭੇਜ ਦਿੱਤੀ ਆ। ਇਸ ਕਰਕੇ ਬੜਾ ਕਨਫਿਊਜ਼ਨ ਹੋਇਆ ਹੈਗਾ। ਹੁਣ ਇਹ ਮੈਟਰ ਜਿਹੜੀ ਹੈ ਮੈਂ ਰੇਜ਼ ਕਰਨੀ ਨੈਕਸਟ ਵੀਕ ਵਿਦ ਦਾ ਮਿਨਿਸਟਰ, ਕਿ ਵਾਈ ਦਿਸ ਇਜ਼ ਹੈਪਨਿੰਗ, ਕਿਉਂ ਇਹ ਹੋ ਰਿਹਾ ਹੈਗਾ। ਇਹ ਮੈਂ ਐਡ ਕਰ ਦਿੱਤਾ ਜੋ ਵੀ ਐਕਸਪਲੇਨ ਕਰਨਾ ਹੈ ਵੈਕਸੀਨ ਦੇ ਬਾਰੇ, ਤੇ ਮੈਨੂੰ ਤੁਸੀਂ ਕੋਈ ਵੀ ਕੁਐਸਚਨ ਜਿਹੜਾ ਹੈਗਾ ਭੇਜ ਸਕਦੇ ਆ, ਤਾਂ ਕਿ ਮੈਂ ਨੈਕਸਟ ਵੀਕ ਮਿਨਿਸਟਰ ਦੇ ਨਾਲ, ਵੈਕਸੀਨ ਮਿਨਿਸਟਰ ਨਾਲ ਕਲੀਅਰ ਕਰ ਸਕਾਂ। ਥੈਂਕ ਯੂ, ਧੰਨਵਾਦ ਆਪ ਸਾਰਿਆਂ ਦਾ। ਮੈਨੂੰ ਪਤਾ ਕਿ ਯਸਮੀਨ ਨੇ ਸਾਰੇ ਮੇਰੀ ਪੰਜਾਬੀ ਅੰਡਰਸਟੈਂਡ ਕਰ ਲਈ ਹੈ ਚੰਗੀ ਤਰ੍ਹਾਂ, ਬਾਕੀ ਜਿਹੜੀ ਆਫਿਸਰ ਗੁਜਰਾਤੀ ਬੋਲੀ ਹੈ, ਬਹੁਤ ਸੋਹਣੀ ਗੁਜਰਾਤੀ ਬੋਲੀ ਹੈ। ਮੈਂ ਕੁਝ ਵਰਡ ਜਿਹੜੇ ਗੁਜਰਾਤੀ ਦੇ ਪਿਕ ਕਰਦਾ, ਪਰ ਮੇਰਾ ਜਿਹੜਾ ਸਿੱਧਾ ਡਾਇਰੈਕਟ ਆ, ਮੈਂ ਪੰਜਾਬ ਤੋਂ ਆਇਆ, ਮੈਂ ਥਰਡ ਰੂਟ ਥਾਣੀ ਨਹੀਂ ਆਇਆ ਇੱਥੇ, ਇਸੇ ਕਰਕੇ ਮੇਰੀ ਗੁਜਰਾਤੀ ਬਹੁਤ ਕਮਜ਼ੋਰ ਹੈ। ਥੈਂਕ ਯੂ।
Thank you, Roshan bhai.
Thank you.
It's Britain Got Talent, I think, on this today.
Put everybody on the spot. That's what we've done, really. Yes, you're breaking up a little bit.
Okay, Zafar?
Yes, thank you. I just wanted to say something about a couple of those things that got mentioned earlier on. Firstly, the first one was about the vaccination and how quickly it was done. It was also because everybody was working together to get the solution to this biggest problem. It stopped the world in its tracks and everybody worked together. So there's all universities from across the world all working together to try and get the vaccines done as quick as possible. And also all countries do their vaccination approvals independently. So not just the UK has approved it, but lots of other countries across Europe, across the world have approved the same vaccine. So it's perfectly safe. And the other thing that you mentioned, that all these falsehoods that are going around, all these WhatsApp messages, that it will change your DNA, it will change the opportunity for your fertility, it will, somebody will be able to track you. It's all false. All these falsehoods have been sent around. They're absolute lies that they're sent around just to stop people to think that it's not real. You're more liable to be tracked by your mobile phone than your vaccine or anything else like that. It doesn't affect your fertility and it can't change your DNA. It doesn't make any difference. And actually, if you look, lots of people said, oh, COVID is not real. And it's not happening and it's not there. It's just some false made up sort of illness that somebody's made up. You only have to go to the Qabristan or the graveyards and have a look at how many people have been buried over the last few months, over the last 12 months. I went to a funeral a few weeks ago and I was shocked at the numbers of graves that have been dug in the last 12 months. So that's how real it is. And the other thing I wanted to mention is the risk is there for BME people in particular, and it's always been there for BME communities in the last 12 months. You just have to go on the BMJ website, that's the British Medical Journal, and if you look on there, they've got a list of all the doctors who have died over the last 12 months. And it's not rocket science, it's not difficult to realize that majority of them are all from the BME communities. And lots of people that we know have been affected by this. I know lots of people that have died over the last 12 months, quite a few people. They would have been saved by the vaccine. If they had their vaccine, they would not have died. The biggest contributor to saving people's lives in the last 100 years is clean drinking water and vaccines. That's the reality. The vaccine will save people's lives.
So can I just ask to the medical professionals, we've got Fabida and Dr. Sulakshmi, why is it that people from Black and ethnic minority communities are more affected by COVID or more likely to be harmed by COVID?
So sorry. Fabida, did you want to come in? Or
yeah, I can say that there have been lots of different explanations. So some of them have been due to prolonged, kind of experiences that BME community have had for generations in this country. So there have been studies to show that those kind of microaggressions, racism, all have played a part in how we have felt over the years, and there are special terms and all used for that. On top of that, there's also the fact that many of us who are from BME communities also have comorbid conditions, just like other communities as well. Like we may have diabetes, we may have high blood pressure, we may have, so COVID affects people with other conditions more than without. Even among health professionals, you see people from all backgrounds, especially from BME, who are young and unwell. And sometimes it's also when you work in very high environments where the amount of COVID virus that affects you is quite a lot. So there's a lot of different explanations that have come, but clearly the evidence has shown, there's lots of studies to show that BME is very much more affected. I'll just say a few more things. I've been trying so hard to convince most of my patients to take the vaccine. Some of them have just trusted me. I think the fundamental thing is the trust. If you trust somebody who's asking you to take the vaccine, they'll take it. And I think we have to use every way possible. So I remember seeing a video of you, Yasmin and Shami on Facebook. I think that will make a huge impact. You did really well. I think if I tell my patient who then has another friend who's a patient, they're more likely to listen to the other patient rather than me. So I think we have to use everything possible. And I agree to have a script and do it in all the languages possible. But also, there are some really difficult stories from families who've lost loved ones. And I think some of them may be willing to come forward and say, please take the vaccine. We lost somebody in our family. We don't want that to happen in your family, because it could be really the difference between life and death.
Yeah, I think that's so important. And you know, if we could look at doing something like that, I think that would be really helpful. As you say, you know, it can come from any of us, but actually from your peer or somebody, you know, like you, the trust is greater, isn't it?
Yeah.
Shami, I don't know if you've all seen the Facebook video, but Shami was the star of that.
Yeah,
Shami,
you were great.
I think you've got 3,500 views almost now.
Yeah, you've done amazing.
So that message is going out, and actually, in my day job, I work for NHS England, and they're wanting to turn that into a film to put out wider. So it is about that trust that we can engender in people, isn't it? Rather than the professionals telling people. Yeah.
And I think what people need to remember is the COVID vaccine cannot kill you, right? It's the COVID which can kill you, which can, you know, really, there's that thing. Whereas the COVID vaccine is safe. That's not going to be the cause of killing you. You know, you'll be saving lives with the COVID vaccine. You'll be saving not only your life, but saving the lives of others. And that's what they need to remember. It's not just them, they're saving the lives of the other loved ones as well.
Absolutely. I think, Fabida, you raised a really, really good point about that.
And I think that
Yasmin, are you there? You're frozen on us.
No, go on. You go.
I was just going to say, you raise a really good point about trust, because it is that, and I think the more it's become a bit of a trend at the moment that anybody who's got vaccinated, they put it up on social media that they've been vaccinated, and I think that's really good as well, because then if it's somebody they know, oh, if they're taking it, then and you know, you ask people who've had the vaccination, did you get any side effects, what happened to you, etc. Most people generally are fine. So I think those conversations with people that they actually know, rather than somebody else telling them, is really, and people they trust, I think will make a difference. I think it's a really good idea. Maybe, you know, even having something out there where people have said, you know, I've had it, and it's somebody they identify with. So even if they don't know them, but they identify with that person, that will make the difference. Just like the ones that they've done with famous people, but just people from their own.
It could be many of you on the screen who people trust, and you know, you can make a big difference. It could be faith leaders, it could be community leaders, it could be anybody. It's just that how can we give that clear message? And I think even age range, you know, you can have older people and younger people. So then those people in those age groups will think, yeah, they're just like me, why can't I take it?
Yeah. I mean, look, you mentioned, you know, people who have lost loved ones, and I'm somebody who has. It's not been long since I lost my dad to COVID. So I would say to anybody, please, 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 if you're offered the vaccine, take it. Because my dad passed away in December, and I was thinking, if only, you know, the vaccines were available then. They weren't. So anybody out there, please do take it if you're offered it. You know, it's as the doctors have said, it's not just safeguarding yourself, you're safeguarding your family, your loved ones, everybody.
Thank you for sharing, Hannah. I know how difficult that was, but it's really important that people understand that, you know, this has impacted families in this way. There was a really important point, though, you made, Fabida, about age, because I think what we're seeing, particularly in Asian communities, is that the older population, so you're over 70s, etc., are accessing the vaccine. And I think generally that, you know, they trust their doctors and medical professionals, but the younger age group, a bit more resistant, is what we're hearing. And it's maybe for a range of reasons. They may think that they're fit and healthy. There's also people who say, well, if I've had COVID, should I have the vaccine? So how do we address that younger age group and convince them that it's the right thing to do? Zafar?
Yeah, I was just going to say, I've got at the moment, my cousin's son, who's about 28 and really fit and healthy. He's a bodybuilder almost and everything else. He had COVID, he's ill in hospital. And I've agreed with him when he comes out, he's going to do a video, because it affects people who are young and healthy as well. And it knocked him for 6, literally. And it's something that is really, really quite serious. And he was one of those same people who were saying to me not so long ago, oh, I'm not too worried about COVID, I'm fit and healthy and I'm strong and everything else. So it really does take a lot out of you. And it's really important that people understand that they're not only putting themselves at risk, but also their extended families at risk. So there's other people within their households who would have been extremely at risk, but luckily they've had the vaccine. So the vaccine has made a difference in that particular household. But we've got to make sure as many people as possible, even of all age groups, have the vaccine so that everybody benefits from that, because otherwise there is lots of people who will be put at risk.
Thank you. And Abdish?
Yeah, I think also we have to highlight the earlier message that came from the health professionals were also that the young people are more resistant to the virus, or they're not having the kind of the impact health-wise, or they might not be dying for COVID. They might just have a COVID and then they recover without even noticing that. That kind of early message has actually misled many young people, or made them actually reluctant to take this one, because they can actually survive without having any vaccination. So this could be something, and I think I commend what Brother Safar said. For that young person coming forward and putting the video together, it would be actually a fantastic opportunity in terms of communicating with the young generation.
So just in terms of that and the message to young people, because by and large they are healthy, and they may just have a bit of a flu or cough, and as we know, a lot of people who have COVID, I think it was 1 in 3, don't have. What's the message to them? Because it's about families, isn't it? It's about the generational thing.
Yeah.
I don't know if anybody's.
Well, I think the important thing is they need to remember, we do not know with the COVID how much immunity you have got and how long is the immunity for. So it doesn't mean that you've had COVID that you shouldn't be having the vaccine, because the vaccine does give you a lot more immunity to stop you from getting serious. It doesn't stop you from getting the COVID, but it stops you from getting seriously ill with the COVID. But with people getting the COVID before, we don't know how much actually immunity and how many months it's going to last for. So I would just say to everybody that they really need to go and have the vaccine if they've been invited to the vaccine, to get the vaccine. Also, if they do get it, it's the older people, the other people in their household, so they might come down with just a flu or something, but the people in their household might get seriously ill with it and might even die. So hence the reason for saying that actually you really need to, if you're getting invited for the vaccine, please go and get the vaccine.
Yasmin, Dave's had his hand up for a very long time.
Sorry, Dave. I can see it now. Go on.
Sorry, yeah, I don't mind that. It's been just to say it's been absolutely really interesting listening to some of the comments. It reminds me really of the need to provide information at a pretty basic level to people, really, and in terms of some of the questions that you have. We tend to forget that because we tend to think we've dealt with that, we've put loads of information out, we're over that, and clearly we're not. So just to say it's really helpful to hear that. And all I would do is make the offer, because I think Salaxni, the way she described the way the vaccine had been developed, I think was really helpful in very simple terms. And we sometimes, and even when we're talking to sort of English speakers, we tend to put it in very bureaucratic ways. And it just struck me of how sort of good and how useful that very that analogy, if you like, of clearing the roads, etc., was really helpful. And I think I'm more than happy to talk to people about how we can perhaps simplify it, which isn't to suggest for one moment that people aren't capable of understanding, but actually is useful for any, when you're talking to people in any language, is to keep it very simple.
Yeah.
So I'm absolutely would love to talk to people about that. Yeah.
Yasmin, I was just going to, and also for people with learning disabilities and communication, that information, the way it's relayed, I'm sure some of it is already being done, but definitely looking at that again as well.
And if I can just say, I think on that point, that's a really good point. I think there is a tremendous amount of information out there, and we've got to find a way of getting it to people. Because I can sometimes sit here a bit frustrated saying, well, we've got that, we can deal with that. But I think what we need to do is try harder to present it in a way that you can see it and so on. And just to say on the easy read stuff, that's often the better stuff to read, I find, to be honest with you. So there you go. But thank you.
Yeah.
Yasmin,
No, that's really helpful. I'll bring Rashid in a minute, but just on that, in a minute. But Dave, just on that, easy read information. But it is like, you know, that very simple language that I think is even more powerful. So you know, that would be really helpful if you could think about that. And I know people, you know, on this call, Aisha, we can't see her. People will be happy to be part of that if you want them to. Rachna?
Thank you, Yasmin, and we'll definitely take that offer up. If Aisha's up for it, we're always willing to do this in a way that works for the people that are supposed to be receiving it. I just wanted to pick up on Sulakshmi's point earlier, which I think is really important. I think we sometimes haven't quite grasped the importance of it, particularly for the communities that we're talking to on this call, is that multi-generational family. So regardless of whether you're living together or whether you're shopping for family members or anything like that, we are very close-knit families, and therefore if the younger population is not getting vaccinated, the risk still remains for the older population. And I think that's a really key message across all of our communities, that the reason the young people have to get vaccinated is to protect the older population. And that for me is a very simple message. You know, I've got 14-year-old twins, both of them, and you know what boys are like when it comes to hand washing and hygiene and things like this. Both of them are terrified of bringing something into my house, because we also have our in-laws living with us. And therefore it's in their psyche already that I have to look after myself because of ba and dada. And I think that's a really important message that we need to get out, and it's our responsibility to get out into all of our communities, that's the reason why we're doing this.
That's really helpful and very clear, because I think it is those myths, isn't it, that I'm not going to fall ill, but it is about the vulnerable people that you come into contact with. I'm going to bring Asma.
Just going back to can you hear me?
Yeah. Rahana.
Yeah. Just going back to being carers, obviously we went into shielding back in early March, and we've just been through a very unfortunate circumstance where my husband actually got COVID even whilst we were in shielding. So it is absolutely so vital to have the vaccination no matter what situation everyone's in, especially as right now we're the only support that Aisha has. So myself, my husband, and my younger daughter is the only support that's Aisha has, and I'm sure it's like that with other BAME communities where they're not having any carers in. I mean, Aisha's never had a carer; it's always been us. But I know other people have, stopped their carers and that. Now going back to my husband, because I mean, we never thought one of us would get affected with COVID, because we are just so safe in what we were doing with in terms of keeping safe. But this just shows how vital it is to have the vaccination, because anybody can be affected no matter how safe you can be. And I'm sure at some point Aisha will put up a video. Sorry, it's just unfortunate today her mic, she could whiz around here, I'm sure, but if you want to, or you just want me to speak, yeah. But she is willing to put a video up, and I'm sure you'll see that going up on social media, or she can share it with Rihanna, and they can work on where it needs to go up. So, yeah.
Thank you, Rihanna.
I'm just going to read out this chat from Shirin. Not our Shirin, another Shirin that's joined us. Hello, everyone. One of the concerns that young parents have is that it will make it difficult to have a baby in the future. Is this true? Explanation, please. And Shirin joined us later, so she will have missed the comments that you made earlier.
So can I just come in on that one? So I did write So I'm not sure where these false rumors are coming from. So we have had, this has been tested, and there's absolutely no effect on the fertility, and there's been no studies to show that there's going to be an effect on the fertility. We have checked it with our consultant gynecologist, with the embryologist, and everybody says it's absolutely safe to have it. So that all those things need to not be thought about, and it's absolutely safe to have the vaccine. It will not have an impact on the future fertility.
Thanks for that.
Thank you.
I think the positive message about vaccine is it helps to have more and more babies.
Well, you'll be safe, isn't it? You wouldn't die from the vaccine. You'll be very safe. You'll be still alive, so you'll definitely have the babies.
Yeah.
Definitely. Just in terms of the different vaccinations that are available, because again, you know, it's really confusing, and you know, there's the Pfizer, the Moderna, you know, people are hearing different things and don't know what they should be doing, which one they should be having. Do they have a choice? And how effective are they all as effective as each other?
Yes, all the vaccines are effective. Yeah. The whole idea of having the vaccine is that stops you from getting seriously ill with COVID and getting hospitalized and going into ITU. Both the vaccines offer good amount of good safety, good safety against that. So I think, you know, I wouldn't go for the choice. Both the vaccines are equally safe and equally effective. And I would just say, well, whichever vaccines you're offered, please go and get the vaccines. Don't worry about which vaccine it is. They both are safe, they both are effective, and they both will stop you from getting seriously ill with COVID and getting admitted. Of course, you still need to keep your social distancing measures, because obviously that needs to carry on till we are absolutely 100% sure. You need to keep all the, you know, hand washing, using your mask, keeping your social distancing. But both the vaccines, it's fine to have any of those vaccines.
Thank you. And just somebody who couldn't join, I thought she was going to join us, and probably not. She's
Oh.
for some reason.
I'll just check the chat.
She had a question about the effect of somebody with epilepsy.
What was that, Yasmin?
Sorry.
So the question was, what is the effect of somebody with epilepsy? Is it safe for them?
Absolutely. There's no
to have the
interaction with
vaccination?
Yeah. There is no interaction with any medications people are taking for epilepsy or on the epilepsy itself. So absolutely, it doesn't do anything. It doesn't trigger or do anything. So it's absolutely safe to have it with, you know, even if you've had epilepsy, multiple other conditions, complex health conditions, it's absolutely safe to have the vaccine. Can you hear me?
That's helpful. And I know somebody was particularly concerned about that. She couldn't make it. I can. I don't know if you can hear me.
Yeah.
And
Rahana,
you might have to take over if I'm losing my sound.
And we're more than happy to answer anybody's queries. You know, if anybody has any specific queries, they can, you know, obviously speak to their GP, speak to their nurse, speak to the clinical person. But, you know, more than happy to offer any support to anybody if they have any doubts about it. But it's absolutely safe to have it.
Okay, thank you.
Got a message from Aisha, and she said she is very happy to do a video for us. So wonderful. There you go.
Brilliant. That's great. Thank you, Aisha. Asma, did you want to come back in again? You've got your hand up.
I just haven't put my hand down again.
That's okay. I mean, the session, it's really helpful because a lot of the people that we work with, you know, are carers of people with a learning disability who often make decisions for their loved one. So we wanted to give them the confidence, and Asma, you know, you being here as a carer is really, really helpful in terms of getting that message across, but also people with mental health difficulties. And of course, you know, we know that all the false messaging really has an impact on them and their well-being and how they perceive things. And so, you know, these clear, very simple messages, I think, are really helpful. Shamima's with us, and Abdish?
Yeah, I'm just asking, are there any guidance for specific families with young people with a learning disability or adults with learning disability? Because sometimes due to probably being advocate of their children or young people, they need to get further information about any other underlying condition the young person or adults with a learning disability may have. And I think the doctor already mentioned about there's no interaction with any other medication or anything. But some parents might actually still be reluctant, given that underlying condition is with the learning disability, so that they might be reluctant. And particularly I'm talking about the BME community and Somali, for example. whether there are any guidance, specific guidance for families and carers of people with learning disability with regard to vaccination.
Can I just mention here, sorry, it's Zafar. All carers, all main carers are allowed to have the vaccine. And lots of people from the ethnic minorities don't class themselves as carers. But if you have to look after somebody who's frail, elderly, or any member of your family, you are classed as a carer, and you need to make sure that you get vaccinated because you are their main carer. And lots of people out there who are caring for people don't realize they are actually carers. So they need to make sure that they get their vaccines, and people with learning disabilities have now got the ability to be jumped up the queue, and they should be getting their vaccines because they're really important. As Asma said, if they're looking after somebody who is vulnerable, they need to make sure that they don't fall ill themselves, because then all of a sudden it becomes a really difficult position for everybody.
That's really helpful, just clarifying that point about carers, because as you say, a lot of people won't class themselves as a carer. Can I just ask, in terms of people with learning disabilities at the moment, so a lot of people may not be on a GP's register. Can they still access the vaccination?
Yes. So the way it works is obviously if you're learning this, I mean, currently the GPs are working through their registers as to who is classed as a learning disability and calling them for the vaccines, because we are working through the cohort 6, which is, you know, people with multiple health conditions. So if you do think somebody has got a learning disability and they're not on the GP's register, I would just say to flag it to your GP so they can put a flag on the system to make sure they always prioritize, because learning disability people are a vulnerable group and we want them to stay on the priority list of the GP. So if they're not on the list, I would say just call your GP up, say that they have got learning disability, and for any reason that they've not been flagged up by the system, that will help them to flag it up and call them for the vaccine as a priority. I think it's because we have to work through those flag systems, but you really need to call it. And the same thing like what Zafar mentioned, if you are a carer, but you don't class yourself, just let your GP know. They'll put a flag that you're a carer and they will prioritize your vaccine and call you in. You don't need to take any proof or anything at all. As long as you just tell them, they will do that for you.
That's very helpful, because I think that's one of the concerns about who's on a register.
Yasmin, you break.
Call a GP and let them know the carer will have learning disability, and they'll prioritize you. Vaccine. Shami, did you want to say something? Rohana, you take over.
There's a message from Dr. Fabida. When you go for the vaccine, they will ask about health conditions. Make sure everything that is relevant is covered, so there is no need to worry, and you can ask them anything as well. In addition, you can ask your own health professionals. Is that a message to somebody before? No, yeah, that's fine. Okay, Shamima, what would you like to say?
Can you hear me?
Yes, I can hear you clearly.
Okay. Basically, I'm a person with a mild learning disability, and I had my first vaccination a couple of weeks ago, and my message is the vaccine is completely fine, and just don't listen to any rumors. Just trust the doctors, and it'll be fine, you know. And
well done, well done. I'm really glad to hear you've had your vaccination, and
you.
Your message is really important for everybody else as well. Really good.
Thank you.
Thank you.
Risham's got his hand up. Yasmin, if you want to.
Risham?
Yes. Yasmin, there are one clarification. I think the government has already made that clarification. The people who are here illegally and also overstayed, and they are not registered with GP, they can get this vaccine done. But I think that still those people who are overstayed and came here illegally, they are still very fearful about this. I don't know how we can just go to the worship places and invite those people to come. If the GP can make an effort to come to the worship places like Gurdwara, I think then that problem can be solved. I don't know how to go about it. There are a number of people I know who are working on a very low wages on the building industry. but they have come. They are not legally here.
Okay. Thank you. That's a really important question. Rachna, do you want to respond?
Yes, please, Yasmin. It's a really important point, and I think it's something that we know locally is something that we have to address. So we're doing two things. The first one is that we have a mobile van now that we have we're just in the process of repurposing, and we're going to take that mobile van into our areas where we know we've got either big sets of factory workers where we know some of those are perhaps not not documented and so on and so forth, or whether we know we've got populations where we're worried about those types of people. So that mobile van starts in 2 weeks' time. We're just waiting for the signs and things to come through. So that's one thing. The second thing is really important about the places of worship, and you're absolutely right that people trust these places, and that's what our process should be. So we've got a list of mosques and a list of gurudwaras, a list of mandirs that have all put themselves forward for places where that we can do these clinics. They're spread across the city, and they're spread across all of the different cohorts within religions effectively that we've got. So hopefully within the course of the next month, the majority of those should be up and running. Of course, we know it's Ramadan in a couple of weeks. So again, we will make sure that we capitalize on that as well. So we are also looking, actually, I'm going to take Zafar's credit here. This was an idea that Zafar came up with, to have clinics between 8 o'clock and 10 o'clock in the masjids locally, so that we can make sure that we've got people coming to places that they trust. So as we learn more and more from each of the communities that we're visiting about what works for them, we will start rolling things out in those particular areas, and always willing to have more ideas.
Thank you. That's helpful. We're also working with the Muslim Council of Britain, the FMO and others, to produce guidance for Ramadan. I think particularly because I think Zafar's idea is brilliant, but people may be worried about feeling ill and not being able to fast. So we're trying to cover that kind of stuff, but also in terms of testing, particularly with schools going back, and teachers and students testing, just getting some guidance around that to assure people, that it's okay to do that while you're fasting. So brilliant initiatives, I think. So Asma?
Just wanted to say one more thing along what Shamim was saying, is regarding, because I'm part of Rainbow's Hospice because of Aisha, and one of the stigmas there amongst the Asian families is, with the underlying health issues. Now, I know it's absolutely fine. We've been on webinars related to metabolic teams and things like that, and we know there's no issues in giving vaccinations with people with underlying health issues, disabilities. But I have experienced in our community already through Rainbow's Hospice and other organizations where families are reluctant to give their adult, disabled son or daughter the vaccine because of their underlying health issues, and they think that the vaccine is going to make them unwell in other ways, So it's just something that to think about and maybe address as well.
Sorry, can I come in on that?
Yeah.
Please.
I think what we need to address is they're more likely to get seriously ill from COVID than from the vaccine. So vaccine can give you some things like arm ache, a bit of a headache, a bit of a flu-like symptoms. But especially those who have got long-term conditions. So, you've got any other long-term conditions or any other disability, you're much more likely to get even more seriously ill than somebody else with COVID than from the vaccine. So actually, that's even more a reason that they should be having the vaccine rather than not having the vaccine. So I think that's what the message needs to go out is, the chances of you getting seriously ill from COVID is even more. So please come forward and have the vaccine. All you'll get is a bit of a, achy arm, if at all anything. But that's about it, and maybe feeling a bit unwell for probably a day and getting a bit muscle ache, but nothing more than that.
Thank you. And I think you're right, Asma. That's one of the reasons why we wanted to have this conversation as well, to assure people that it is safe, for your loved ones, your son, your daughter, your brother, your sister, who may have a disability. Just something that I know none of you, I don't think any of you are from UHL, but there was an article in the newspaper about people who work at the hospital from BMA, Black and Ethnic Minority communities, not accessing the vaccine, and that kind of sends a message to say, well, if they're not doing it, why should we? How do we address that?
So sorry.
Go on, you go, then I'll go.
No, so I think, you know, some people like always, you know, we obviously, some people hear the negative messaging and all that, but again, you know, obviously they have seen the importance of having the vaccine. They have seen how people are seriously getting ill with COVID, and they are now more likely to come and go forward with the vaccine. So they are looking into it. Of course, people sometimes do have queries, but that's all been addressed, and they are now, the uptake is definitely increasing with our health and social care workers with the vaccine. It's definitely on the rise now. So they are feeling more confident about the vaccine. So yeah, absolutely going in the right direction.
That's good to hear. Rachna?
So Yasmin, if I may, one of the key issues that when we were talking to those staff groups was this fertility issue, and the fact that it hadn't come forward front and hadn't been directly addressed. So once we started to do similar groups like this with those staff groups, say actually what is the problem, why are you not coming forward, a lot of the queries were about fertility. As Salakshmi said, we've addressed all of those either single person by single person or by Zoom calls like this. And the numbers have suddenly started to shoot up, particularly in our female cohort, across those younger cohorts that we've got who work in health and care. Just as an example, our domiciliary care workers, we were getting a very, very strong message from them in the same way. We did one of these calls and we were at about 38% of people being vaccinated. Within a week, that went up to 60%. So it just shows that once you address people's, people's fears, and let's be honest, they are fears because these are people's lives. So, you know, we have to take this seriously and make sure that those questions are answered. But once our clinicians had answered those questions, people are more than happy to come forward. So you will see those numbers start to grow week by week now.
That's fantastic to hear. And I think you're right. It is about not dismissing, but listening to what people are saying and addressing those fears. Absolutely. Dave, did you want to come in?
Yes, it's something similar to what Rachna and Slachny have said, really. I think you learn about these things in communication, so we're always learning as we go along. And you know, the sort of what I would call the mass communications of just putting messages out there works for, say, a majority of people. They respond to that message and they've already made their minds up about the vaccine. And then it sort of requires more, well, you start off with more group discussions, if you like this, and some people then that, as Rachna said, as some people have had their questions answered at that level. And then I think you're on to very direct conversations with individuals, sort of, you know, face one-to-one conversations with people. So we know it's not, you can't just solve it by one approach at all. It's many different approaches, I think, at different levels. And, you know, this is showing me how rich you can have a conversation can be just in this group. So again, an individual conversation can be even richer in terms of what you get. So it is shifting, as Salakshmi said. And I think that is, you're right, just as much as people not having it might put other people off, the more people have it. And I think it was Zuffa right at the beginning that said we've got to talk a lot more about that, actually, that the vast majority of people are having this, and that is growing and growing. I think that's a really important message as well.
Yeah, thank you.
I think I was just going to say, Salakshmi's message is already in my head as a really good way of explaining to people that having the vaccine is much more safer than getting COVID. And I like that comparison. And I think it's another simple message that you've given, just like your London road being clear, the road to London being clear, you know, but it is those analogies and those simple examples that it's already stuck in my head. So you can imagine anybody else, you know, so I think the messaging is key. It's really important.
And that simple messaging, absolutely. Fabida and then Abdish.
I just wanted to say that staff groups are also like, you know, any human group.
Yeah.
And the more they have it and they tell their peers, the others have it as well. And if it's still in anybody's mind about fertility and pregnancy, I'm happy to say that I do know people who've had the vaccine and are pregnant. So I don't want anybody to still worry about this fact. That's what I wanted to say.
Thank you. Yeah, thank you.
Yeah, I just want to concur what Dave mentioned. I've been talking to someone whom I met in Somalia. I visited there recently, and there's so many myths going on there in terms of the prevention of COVID. And one of them, Somalia has a very unique type of sheep with a black head. And people are saying, look, consuming their meat will cure any COVID, but also prevent any COVID contraction in the future. And now then, after a few weeks, then I called that person, just general chat, and then I said, what's your views on vaccination? Now then, he came up with another theory of depopulation of Bill Gates theory. You know, there's so many things, and I totally agree with Dave. People are moving from one kind of extreme to the other in terms of misleading information to people. But we also need to understand that the majority of people now are very receptive and very positively responding to COVID suggestions. But we also need to actually create a platform where people can actually debate, those who have negative views and those who have positive views. And I think the community can actually play a very big role in that, but also the mosques as well. The other things that also people are talking about, whether the vaccination, the content, the ingredient is actually, you know, halal or in compliance with Islamic perspectives. So we need also the shuyukh, and I know FMO and also Muslim Council of Britain are doing quite a great job there in looking at the content and the ingredient of those vaccination are not, you know, against Islam or haram. So that message, I think, needs to go further. But also we need to be smart with also the conspiracy theories as well. Thank you.
Yes, have you frozen? You there?
The same across all about faith healing, about alternative medicines. Have I frozen? Yeah. Okay. Can you hear me now?
Yeah, I was going to say there are lots of claims that do this and you won't get COVID and you won't need a vaccine, or eat this or buy this medicine, and people are ordering things online and things from India or anywhere else, and they really have their faith in that, and they're thinking that's it, we're going to be protected, we don't need anything else. So it is quite, especially when these are people who are claiming to be healers or faith leaders saying these things. So I think that's my one point I want to raise again. I know we're going backwards, but the reason why I want to raise it, because there are lots of people who will then just do that and nothing else, because they're thinking, well, I've not got it so far, so I'm not going to get it, and then that's it, because this must be working, whatever I'm taking. And that is a concern. And the second thing I would say is there was, I know there's lots of things like this going around, but there was a video going around which apparently, I didn't watch the video, but I was described it, where a person had been part of a study, vaccination study, and had had a really bad reaction, and it had somehow made this person disabled. And apparently this study was in India, and I was trying to explain to this person, this is not true, don't believe this, but these people do, and that person is reluctant to take the vaccine. So I know it's two completely different points, but I wanted to raise both of them, because regardless of what we think, other people are going to believe these things.
So in terms of the messaging, you know, those kind of things, as you're thinking about further messaging, really important to address. I'm just going to give everybody the last opportunity, because I don't want to keep you too long on a Saturday afternoon. Is there anything anybody else wants to raise or say or ask? Rachna?
Just to take the opportunity, Yasmin, to thank everybody who's joined the call, and just to reiterate the offer from us that if there is any community that you would like us to speak to, we've got a huge plethora of colleagues across health and care who speak much better mother tongue than I do, but willing to come to any of these kind of meetings that to help.
Thank you. That's really appreciated. Dave?
Rachna took the words out of my mouth, actually, in terms of, you know, I've left my email address for people. Please do, if you've got ideas at how we can, you know, get the message over, we're absolutely open to that, and we'll be delighted to support. And just to say thank you for letting me come along, because I've really enjoyed it, actually. It's really been helpful. So thank you very much.
Thank you for coming. Sabida?
Yeah, I just want to say thanks to everybody, and also just taking on Rehana's last point is that a lot of people are taking complete advantage of, and that's a concern. And I think people who get messages and, you know, all these kind of videos should be able to speak up and talk to people and ask. And also there are risks associated with taking certain medications or treatments that are not licensed or good for you. So please don't take anything unless you speak to somebody professional, whether that's safe or not, whether you think it'll not save you or not. And also don't let anybody take advantage of you, you know, through these messages. So that was one thing to say.
Thank you.
Abdish?
Yeah, just a quick, you mentioned that this will be recorded, Yasmin. Where will it be available to, if people want to watch it or something?
So, Rohan, if we could talk to Rachna and Dave about how we get that out, and then we'll let you know. Yeah. Okay. So, again, thank you everybody for Rachna and Dave. You've got your hands up. Is there anything else you wanted to say? No. Okay.
No, just to say, absolutely, we can help you get the video distributed. That's not a problem.
Thanks, Dave.
Brilliant. Okay, thank you. Okay, thank you everybody. It's been really helpful, and I hope what we've spoken about today, you know, as we share this video, is going to help other people to feel a bit more confident. And again, thank you for the offer to kind of get the message out wider. We're really keen to help you, to help our communities, basically, and particularly in Leicester, where we're hearing all kinds of things about rising rates, etc. You know, we want to try and get the city out of lockdown, and we'll do everything we can to try and help. So thanks again, and enjoy the rest of your afternoon.
Thank you.
Thank you very much.
Thank you.
Bye.
Bye-bye.
Right, Yasmin Men, before I stop the recording, right, shall we just pause?